Dr. Daryl Hudson is back from Washington University. Help us put a nice bow on the end of this here, if you would. What are you hearing? What have we missed?
Sure. Well, I think that the last panel did a great job of bringing up an issue that's of great importance, which is mental health, which is often under the radar. I thought you did a great job of reminding people that health disparities are avoidable.
That was your word. I wrote that. That was, and that's
well, you reminded them.
Well, and it's resonated with a lot of people.
Sure.
And another word that came up during our panel was shame or shameful. That kind of the onus is on us. It sounds like.
Sure. A lot of people really get riled up when they think about disparities in terms of the inequality that people see, the living conditions that people are under, and it really does affect health. And so I think that the last panel did a really good job of highlighting some of where that comes from, not just from a genetic angle, but from the lived experience, the socioeconomic stuff, but also just thinking about the stigma that is associated or attached with certain racial ethnic minority groups, for instance, sexual orientation minority groups as well.
And Dr. Heidi Miller talked about that when two people walk in the door, once they're in the door, they get the very same outcome.
Sure. I think one thing that is important is a lot of times people at home are thinking, well, what has this got to do with me?
Yeah.
So that's something that I would like to hone in on, is that it's not just the people who are suffering from a health outcome or a community that is battling with health disparities. It's really a regional issue. If you think about people who are not able to get access to medical care, not able to get education, if they can get a good job, and et cetera, and provide for their families, that burden is picked up by society, it's picked up by taxpayers, it's picked up in the form of what we're paying out to provide for people who can't pay for themselves. So if you think about it from a selfish perspective,
it's costing us.
It's costing us, and I think that's something that really people at home or who are not in communities that are impoverished, for instance, really should care about the health of other people.
Does something come to mind as to why else we should care, if you will, to make us sound like really heartless people here? but why should we care besides the dollars and cents?
Sure, I think that part of it is it's a gradient. So there's this great study that was done in Britain called the Whitehall study, and they found that in the British civil service system, that it wasn't just the people at the top of the hierarchy who had the best health. It was at every single level. So if you were in the middle, you had better health than people on the bottom. If you were in the middle, you still had worse health than people at the top. And so again, it does end up boiling back down to dollars and cents. But I think it's in everyone's best interest to care about health equity.
Making a better place for everyone to live.
Everyone.
What else stood out in tonight? Did it resonate with you at all, the doctors going to the barbershop and some of the cultural issues that the last panel brought up?
Sure, definitely. I think that I think that anything that you can do to make people feel more at home, to acknowledge the past, acknowledge the history that is there, to meet people, to show them that we're here for you, we care about you, we value you as a person, we don't see you as a problem. A lot of times when we think about disparities, we think about problems, and people become problems to us. So I think that anything that can be outreach to show people that we don't think about you as a problem, we think about you as a person.
Something we started to touch on there with Jorge and the rest of your panel was the Affordable Care Act. Anything else that you want to tell us about that in terms of how this might address this issue as more parts of the law go into effect?
Sure. Well, I think that a big thing that's hanging on the edge in Missouri, for instance, is the expansion of Medicaid. And so it's a political battle. We'll see what happens there. But I think that would be critical into expanding the coverage gap for people. I think that the CARE Act does do a good job of expanding care. Of course, from a public health professional, I would like to see it go further, but it's a step in the right direction.
Yeah, and I want to go back to something else that you mentioned too. When you talked earlier, these are not just issues that doctors deal with. These are you talked about transportation, and what are some other factors that you see playing into this?
Well, I think the last panel mentioned that it's racial ethnic group membership, but not just about the genetics or any characteristic about a racial ethnic group. It really is the socioeconomic position area that access that people have to resources, not just healthcare, but education, income, et cetera, et cetera. Segregation is something we haven't talked a lot about on the panels tonight. Racial residential segregation is a huge problem for areas like St. Louis. We have high concentrations of, say, African Americans living in one particular area. And that's not just important because it's bad to live in an area that's predominantly African American. That's not necessarily true. The big issue is around the resources there. Is there going to be a Schnucks or a Whole Foods or a Trader Joe's in a predominantly African American neighborhood? And that's something that we have to do something about and trying to, and that comes into ideology as well, which is another thing we didn't talk about a lot about how people are valued in society. And is it your neighborhood, is that something I want to go and visit? Is it some place that I want to live? A lot of Americans, most Americans derive the majority of their wealth from their home value. So as long as we have people who live in predominantly African American neighborhoods, for instance, their homes are always going to be worth less than those who live outside of those communities. So that's a wealth gap that is going to persist.
It's a snowball effect.
Yes.
We hope to see that snowball stop.